Hello, everyone. Hope everyone's enjoying the sunny weekend here. Well, today's topic is on endometriosis and how Chinese herbal medicine, the entire umbrella can help women get through it. To talk about this such a sensitive topic, we have one of the leading acupuncturists from New York City, Dr. Berkley. He has over 30 years of experience working in reproductive wellness. He's a licensed acupuncturist as well as a Chinese herbal medicine expert joining me live right now. Thank you so much.
That introduction was perfect. Thank you so much for your kind introduction. And thank you so much for inviting me to participate. I'm very grateful. So shall I just kind of
Please.
associate? Okay.
Yeah, please.
I'm going to talk about endometriosis. We don't have a long time, but I'm going to talk about endometriosis in two contexts. One will be pain management, and one will be the obstacles that endometriosis cause in facilitating pregnancy. So let's talk about pain management first. So as some of you know, if any of you are watching and you have endometriosis, you know that it's a very interesting disorder. There are 4 stages to endometriosis, 1 being mild, 4 being severe. There are women with severe endometriosis that have zero pain, no pain. They don't even know they have endometriosis. And there are women that have stage 1 endometriosis, literally 1 dot of endometriosis, and they can miss 1 week of work per month, or else they have to be on hardcore analgesics, prescription analgesics. And so there's a couple of mitigators to the pain. And so one is the big thing, which is have a laparoscopic surgery, which is a full-blown surgery where the patient is in the hospital under full anesthesia, and the doctor can be in for an hour, the doctor can be in for 7 hours. And so that's something that can be done. Unfortunately, even after laparoscopies, some patients still feel pain from the endometriosis. Why is that? Because endometriosis has discolored tissue. That's what identifies it as being endometriosis. So when the surgeon goes into the pelvic cavity and he or she sees these miscolored tissues, they resect them, they cut them out. The problem is that some endometriotic tissue looks exactly like normal tissue. So the doctor's not going to cut something out that looks normal. So in that situation, the patient can still have pain even after a laparoscopy. There are 2 basic cures for endometriosis. One is fairly certain and one is 100% certain. The one that's fairly certain, it doesn't always happen, but it happens maybe 55 to 60% of the time, is a woman who has endometriosis who gives birth frequently eliminates the endometriosis. The fact of giving birth changes something in the system, the immunology, and the endometriosis is gone. It doesn't always happen, it happens a lot. The other cure for endometriosis is full-blown menopause, because endometriosis lives on estrogen, and in full-blown menopause, there's just so little estrogen that it does not feed the endometriosis. Now, let's talk. I realize I'm not talking anything about Chinese medicine, but I don't really care, because what I really want to do is help the people that are listening, no matter how we get to that destination. So that's pain management. Acupuncture is very effective in ameliorating and reducing pain as a result of endometriosis. The problem, now the benefit to acupuncture is on a scale of 1 to 10, where 10 is severe pain and 1 is mild pain. Even if a patient comes in with a number 10, she'll leave at a number 5 or a number 6 or a number 7. So it will reduce it, it'll make her feel a lot better. The problem is that she has to get it every month for the rest of her life until she goes into menopause. So I guess that's a problem, but maybe it's a worse problem if you don't get treated and you have pain, constantly, and it's very bad. And the pain, The pain can be during intercourse, the pain can be during defecation, the pain can be severe low back pain, it can be pelvic pain. It can even affect the bladder. It can make you urinate every 20 minutes. So endometriosis is a very complicated and uncomfortable disease. Now, I think I'm going to move along. I'm doing this, I'm rushing a little bit just because we don't have too much time. I'm going to move forward and talk about treating infertility. So let's say that we have a 30-year-old woman and there's no male factor and there's no female factor. Her day 3 hormones are normal, her thyroid is normal, everything is good, but she has endometriosis. So one of the things that happen in endometriosis, so let me back up for a second. About 50% of women with endometriosis can get pregnant, but that leaves multitudinous millions of women who cannot get pregnant because that's the other 50%. So I don't know why the women with endometriosis get pregnant. I don't know, but I know why the women with endometriosis don't get pregnant. And one of the reasons, multitudinous reasons, but one of the reasons women with endometriosis don't get pregnant, couple of reasons. Number one, endometriosis is an inflammatory disease. So even though endometriosis is a disease outside of the uterus, these inflammatory, what's called cytokines, pro-inflammatory cytokines, find their way into the uterus. All anybody has to know is when you're baking the bread in the oven, I don't know anything about baking, so forgive me if my numbers are wrong. If you're baking bread in the oven, it has to be 200 degrees. But instead, when you turn the oven on to 200 degrees, it's really 600 degrees. So the bread is going to get burnt every time. In the uterus, there is a within normal limits temperature gradient. The uterus is not 200 degrees. I don't know what the normal temperature gradient is, but it's like human beings. Our temperature is about 98.6. It can vary a little bit. So in the uterus, there's a normal temperature range. When a patient has endometriosis, due to the inflammatory presentation, if you will, of endometriosis, the uterus is too hot. It's too inflamed. So you can have an embryo transformed in there, and just like the bread in the oven, the embryo will it won't do well. There's too much heat. The other thing is there's something called pinipodes, Pinipodes. Pinipodes are little projections that elevate in the second half of the cycle, meaning in the luteal phase. Implantation typically takes place on cycle day 21 to cycle day 23. And so on cycle days 21 to 23, the pinipodes are supposed to elevate. They help to grab the embryo and pull it into the uterus. In many, 50% of endometriosis patients, the pinipodes do not elevate. So I'm going to give you the Western medicine treatment for this, and then we'll talk about Chinese medicine. So the Western medicine treatment 5 years ago, and many, many patients still think this way, and even some doctors still think this way, which is incredible. So as of 5 years ago and backwards, the solution was to do a laparoscopy, $25,000 on the table for 2 to 6 hours, and that's what you would have to go through. Now, a woman doesn't have to go through that anymore. She has to take 3 months of Lupron, which is a certain kind of medication, Lupron. She takes that either, if she's doing IVF, she takes it either before an embryo transfer, or if she's not doing IVF, she can take that 3 months before she's having intercourse. Obviously, this should be done under the advice and care of a reproductive endocrinologist. One more thing I want to say is, in the olden days, meaning 5 years ago and beyond that, how was endometriosis even diagnosed? It was diagnosed once again through laparoscopy. That is a thing of the past. So if a patient suspects they have endometriosis, and I can talk about that too, but let's just take one thing at a time. If they suspect, or the doctor suspects, that a patient has endometriosis, now all the patient has to do is get a uterine biopsy. It's a 10-minute procedure. It's uncomfortable. It's not super painful. There's no anesthetics given. It's in and out. That's it. And the doctor takes a little bit of that tissue and they send it to pathology. And the pathology lab is looking for a molecule in the tissue called BCL6. If the tissue is positive for BCL6, it absolutely 100% without question means the patient is positive for endometriosis. Of course, we don't know if it's stage 1, 2, 3, or 4, but that's not relevant. She's not getting pregnant. She's 30 years old. Everything is fine. Why is she not getting pregnant? This is a hidden pathology. She may not even have any symptoms. No doctor would send this woman to get a uterine biopsy. None. They would just say, oh, it's bad luck. We don't understand. If I have patients that don't get pregnant and they're 30 years old and there's nothing wrong with them, I send them right away to get a uterine biopsy. And, 35 to 45% come back with positive findings. So that's that. Now let's talk about acupuncture and herbal medicine in the context of getting pregnant. Before I do that, I want to say, and this is very important, acupuncture and herbal medicine should not and must not and cannot replace Lupron. Lupron is far more efficacious than acupuncture and herbal medicine on the pregnancy side. But let's say that the patient is on Lupron for 3 months and she's totally fine. Let's just say IVF. I'm only saying IVF for one reason, because in an IVF procedure, the embryo can be tested. So let's just play with that idea. She has an embryo that's tested and it's normal. And you put it in the patient who's been on Lupron for 3 months and she still doesn't get pregnant. So what I'm thinking is that the Lupron maybe didn't attenuate, maybe it didn't reduce all the inflammation. Maybe there's still some inflammation going on. So in this particular case, herbal medicine is far superior to acupuncture. Acupuncture moves energy around the body. Herbal medicine supports that which is deficient and reduces that which is in excess. So if a woman has a 25-day cycle and she ovulates on day 17, that's a luteal phase insufficiency. Her cycle is not long enough and the ovulation should be earlier. And so when you do acupuncture on a patient that has endometriosis, you can help, when you do herbal medicine on a patient that has endometriosis, herbal medicine formulas are very effective when treating endometriosis patients because there are herbs that have great potential and capacity to reduce inflammation. Now, somebody might say, well, why not do that instead of the Lupron? Well, it depends on the patient's age. If the patient's 38 years old, I would say do the Lupron because you have no time to waste. You're already in diminished ovarian reserve and you already have poor egg quality to some extent. We don't have time to fool around. Take the Lupron and see what happens. If I have a 30 to 33-year-old patient and she's not getting pregnant, she's diagnosed with endometriosis and her tubal status is good, I will suggest doing herbs for 3 months and continue to try to get pregnant the whole time while she's taking the herbs. And if that doesn't work, then we jump in with the Lupron and maybe we'll continue the herbs. So I think that the best case in Chinese medicine from the perspective of enhancing fertility outcomes is to combine Chinese medicine with Western medicine. Now, let's just jump back to the pain segment for a second. Western medicine has no answer for the pain except to give you a prescription for painkillers, and I mean prescription painkillers, things like Percocet. These are very serious addicting drugs, and many endometriosis patients are addicted to painkillers. So that is completely 95% of the time unnecessary. If a patient's main complaint is pain from endometriosis, go to a good acupuncturist who's also a legitimate board-certified herbalist, and they should be able to reduce your pain by 50%. Again, you'll have to come in every month, but it's either that or become a drug addict. And so I think I spoke very quickly and gave all my salient points. Are there any questions perhaps from you or any of the viewers?
No, I think you gave a very high level of, it's a synthesis, I would say, of what endometriosis is, 4 different stages you talked about. It's an inflammatory disease. And then I'm just trying to summarize. And then this is the best way to do that is combining the Western medicine with the acupuncture being very effective for pain management. And that is pain as being one of the key determinants of endometriosis with women who are suffering from that. And then that leads to their pregnancy issues, and they could also get early menopause, right? That's what I'm understanding. I just want to summarize why women should focus to take care of it, because it could lead to early menopause as well, and that could lead to other problems. If someone has an early menopause in their early 30s, that could lead to chronic disease. So this is a very complicated disease, and women should really pay attention if they are diagnosed with endometriosis, right? Do you want to add? It's a quick 10-minute session that we do just to
Yeah, of course. So let's talk about the menopausal aspect of endometriosis. Endometriosis, generally speaking, will not accelerate menopause. Generally speaking, there's not really a relationship between menopause and endometriosis, except under one circumstance. So there's something called an endometrioma. And an endometrioma is an actual endometriotic cyst. It's endometriosis tissue on top of an ovary. There's a term called invagination. Invagination means digging into something. So if you have an apple or a pear, and you take a spoon and you just go like this and pull a piece out, the spoon has invaginated the apple. So in the endometriosis patient who has an endometrioma, the endometrioma can invaginate the ovary. This is very bad because due to the fact that endometriosis is an inflammatory disease, it will serve to destroy and reduce follicles in the given ovary. And so if you reduce, hypothetically, all follicles and your ovaries are dysfunctional, yes, you're going to go into menopause for sure. And the other problem with endometrioma is if it has invaginated and the doctor cuts it out, you're still in the same boat because you've cut out half of the ovary. Thank God the woman has another ovary, so she's okay. Of course, the worst case scenario would be to have bilateral endometriomas. The other thing, of course, to do with an endometriosis patient who wants to get pregnant, even if she's trying to get pregnant naturally, no IUIs, no IVFs, is she must get a hysterosalpingogram to check her tubal status, because very often endometriosis causes tubal obliteration or tubal destruction, tubal scarring, and then either you won't get pregnant or you'll get pregnant and you'll have an ectopic pregnancy. And so it's very important if a woman has endo, not just to worry about taking the Lupron and all of that, but the woman must do a hysterosalpingogram, because if she has bad tubes, then 2 things become evident. Number one, the tubes must be cut out, but a lot of people freak out about that. And I would freak out about it too if I had something of my body cut out. But the bottom line is you'll never get pregnant in 20 billion years if you have obliterated tubes. You'll only get ectopics. So if you cut the tubes out and you do an IVF, you will never get an ectopic because the tubes aren't there anymore. And you have a much greater chance of getting pregnant in the uterus and not in the tube. So that's some important information to know as well.
Okay, well, I think there's a lot of information that you shared. So we'll stop here. That it's a very complicated condition. I highly recommend that you seek a professional advice and professional consultation. This particular session is only to inform and educate and make people, women aware of all the complications that could arise because of endometriosis, right?
Yeah,
and if you want to share your clinic information or anything before I wrap up today?
Sure, that's very kind of you. So the website is berkleycenter.com, which is BERKLEY center.com. And there's a lot of information about everything there. And I'm in New York City. So if anybody's in New York City, I'm happy to work with you. And
Yeah.
If you want to talk to me and discuss your case, even if you're out of New York City, I'm happy to do that and give you some advice and some input. Phone numbers on the website. I'll give you the phone number now. It's 212-685-0985. And I'm happy to help anybody and try to give somebody some guidance. So that'd be my pleasure, of course.
Thank you. And we will be posting this video on our website and creating your profile and sharing everywhere else so people can get in touch with you. With that, have a great weekend, everyone.
Have a great weekend. Thank you very much. Thank you to the listeners. I wish everyone health and Godspeed and recovery and in life. Thank you.
Thank you.
Bye-bye.